So today's topic is hypertension. We commonly call it high blood pressure. It is a very common condition. It affects millions of people throughout the world and in the United States. And most of the time, it does not have any symptoms. So it is called as a stealth killer or a silent killer. So people have high blood pressure, but they don't know about it because it does not cause any symptoms. And most of the time, if we find out that they have high blood pressure, if they go for a physical exam or if they have any other health reasons to go to see a doctor and they find out that they have high blood pressure. So it's really important for us to know about high blood pressure and see if anyone has high blood pressure and try to treat it and control it. So let's talk about why should we care about high blood pressure. I mean, why is it important for us to know what high blood pressure is and how we can we deal with it? About 75 million U.S. adults have high blood pressure. So that's 1 in 3 adults in the United States have high blood pressure. High blood pressure can cause a lot of complications, including heart attacks. So it's a risk factor for heart disease. So 1 in every 44 second U.S. adult will suffer from a heart attack. And every 4 minutes, somebody would die from a stroke. And stroke also can result from high blood pressure. So that's really another reason for us to know about high blood pressure. The prevalence, as I said, is about 1 in 3 adults, or 31% prevalence in the United States overall. But some racial groups have more prevalence. For example, African Americans are affected more by high blood pressure, and they typically have more severe high blood pressure and more side effects and complications from high blood pressure. So about 40% prevalence in African Americans. And adults between 40 and 64, 41% have high blood pressure. And if you look at adults that are 60 and older, 2/3 of them have high blood pressure. So 2 out of 3 adults that are 60 or older, they will develop high blood pressure. So that's a huge problem. So that's why we need to know about high blood pressure and what it is and how can we control it. So those that do not have high blood pressure and their blood pressure is normal, they will typically live 5 years longer than those that have high blood pressure. So the life expectancy goes down with high blood pressure. That's another reason to know what your blood pressure is. If we control the blood pressure, bring it down even by 5 millimeters of mercury, it decreases the risk of stroke, decreases the risk of heart disease, and also improves life expectancy. So taking blood pressure medications can decrease the risk of stroke by 35 to 40%. And heart attack reduction can be from 20 to 25%, and heart failure can be reduced by 50%. So what this slide tells you is that controlling blood pressure is extremely important because it does make a difference. So if somebody has blood pressure, the next thing is that they should do their best to control their blood pressure. So this graph shows that 35 million US adults that have high blood pressure, they are uncontrolled. So in the previous slide I said there are 75 million adults that have high blood pressure. So almost half of the US adults that have high blood pressure, their blood pressure is not controlled. So, and out of those, 11 million that not even aware that they have high blood pressure. So this is a huge problem. So you walking, running around, you're doing your business, and you don't know your blood pressure is up. So 11 million Americans don't know that they have high blood pressure. So hypertension is the technical term, and we call it high blood pressure and in common. And let's talk briefly about the physiology. So the human circulatory system is made up of heart, which is a pump. It pumps the blood into the different tissues and organs in the body, and the blood flows in blood vessels, which are like pipes. They are in different sizes. Some are large, some are small, and the function is to carry blood from the heart to different organs and tissues in the body. So what is blood pressure? So when the blood is flowing through the blood vessels or through the pipes, it is exerting pressure, and that's what blood pressure is. So we have machines, we have a blood pressure machine that we can measure that pressure. So blood pressure can be raised by different reasons. We will talk about that later. So basically it is the pressure of the blood on the blood vessel wall. So this table shows what is normal blood pressure. Normal blood pressure is considered to be less than 120. This is the top number. We call it systolic, and the bottom number is called diastolic. So less than 120, the top number, and less than 80, the bottom number. That's your normal blood pressure. So if the top number or the systolic is between 120 and 129, and the bottom number is still less than 80, we call it blood pressure is elevated. So stage 1 high blood pressure is when the top number is between 130 and 139, and the bottom number is between 80 and 89. That's stage 1 hypertension. Stage 2 hypertension is when the top number is more than 140, or the bottom number is more than 90. Either one of them. So that would be stage 2. And the hypertensive crisis is an medical emergency when you should go to see the doctor or the emergency room when the blood pressure is greater than 180, the top number, and 120, the bottom number. So number to remember is 120, the top number, 80, the bottom number. That's considered to be the normal. So if somebody has blood pressure for a period of time, that high blood pressure is going to damage the heart and is going to damage those pipes. So what it does is that normally those pipes are flexible, but with aging and with high blood pressure, those pipes become rigid. So when you have a rigid pipe and you have some fluid flowing through it, it's going to cause more pressure in it. So making the pipes rigid makes the blood pressure go up. And this the pipes becoming rigid with age is called arteriosclerosis. So high blood pressure will accelerate this process. So makes the blood vessels rigid. So when those blood vessels are rigid, they can damage the inside wall of the blood vessels. So this is the blood vessel and the blood is flowing. This can damage the inside of the blood vessel. When it damages, the body tries to heal it and it forms what we call a plaque. The plaque is made of some fibrous tissue and it is made up of cholesterol. So with time, more and more injury to the blood vessel, the plaque continues to grow, cholesterol continues to build, and you can see that the opening becomes narrow, and it can sometimes completely get blocked. So this is a different view of the same process. We call it atherosclerosis. This is a normal blood vessel. You can see inside nice and clean. This blood vessel has developed a mild atherosclerosis or a plaque made of cholesterol and fibrous tissue because of high blood pressure. With time, it has grown up and become much bigger, and it's just completely occluding the blood vessel. So there is not much space for the blood to flow in this blood vessel. So sometimes this plaque can rupture. So here you can see this plaque has ruptured. As a response to this rupture, the body tries to heal it by making a blood clot. So the blood cells will rush to this area and they try to plug it, and the result is that they can make a blood clot and it can just clog up the blood vessel. So what would happen if the blood vessel is clogged up? So the blood will not flow and the tissue downstream will not get any blood supply, and it is critical for the tissues to get continuous blood supply and blood flow. So when you cut it off, the tissue will die. So if this happens in the heart, here you can see there is a blockage here. There was a plaque which ruptured and the body formed a clot to repair it, and it clogged and it cut off the blood flow to this area of the heart. So this part of the heart muscle is going to die, and this is called a heart attack. If this happens in the brain, then it's called a stroke. Same process. You have a plaque, it ruptures, blood clot is formed, and it cuts off the blood flow to part of the brain, and that brain tissue in that area is going to die, and that's called a stroke. If it happens in the eye, this is the, you can see this is the normal blood vessel in the eye, and this is clogged up. This is the plaque. This is the blood clot. So this will clog up the blood flow to this part of the eye, and it's going to cause blindness. Same way in the kidneys. The high blood pressure over time can damage the kidneys and cause kidney failure. The other thing that can happen with high blood pressure is that if you have continuous high pressure on the wall, it's going to make the wall very weak and thin. So with time, the blood vessel wall can outpouch or make a balloon. And this is called aneurysm. I'm sure you guys have heard of aneurysm. So this aneurysm can be formed in any blood vessel because of high blood pressure. And it can rupture and can be lethal. If there's an aneurysm in the brain and it ruptures, it causes bleeding, and that's a type of a stroke. It's called a bleeding type of stroke. So these are the complications that you see with high blood pressure. Now let's talk about what are the risk factors, why some people develop high blood pressure and others don't develop high blood pressure. There are some factors, risk factors, that we don't have any control over. So we cannot change that. So we are born with the genetics. We are born with a set of chromosomes and genes which are passed on from our parents. So we can't change those. We cannot change our race. We cannot change our age. And this is controversial, but we cannot change our gender. And there are some risk factors that we do have some control over. We can modify those risk factors. Poor diet, obesity, inactivity, stress, tobacco use, alcohol, and other chronic conditions. These are all risk factors that cause high blood pressure, and we have control over them to an extent, and we can modify these and thus improve our blood pressure. So let's talk about the treatment of hypertension. There are two main focuses for the treatment of high blood pressure. One is the lifestyle changes, and the other one is medications. It is extremely important to make lifestyle changes for treatment of hypertension, and it is the first step. When we as physicians see patients that have high blood pressure and diagnose them with high blood pressure, the first thing we tell them is to make lifestyle changes to help with the blood pressure. Sometimes those may be enough. If the blood pressure is not too high, lifestyle changes by themselves may be enough to bring their blood pressure down within normal range, and they may not need to take medications. In other cases, it may not be enough, so you may have to add medications, but this is the first and the foremost step. So eating healthy, that's one of the most important things that you can do if you have high blood pressure. And healthy eating example would be a Mediterranean diet, where you have lots of fruits, vegetables, whole grains, oils like olive oil, nuts, legumes, herbs, and things like that. You also should include fish and seafood, less meat, less sweets, and plenty of water in a day. So that's a Mediterranean diet that is helpful for controlling your blood pressure. By the way, this is not the Middle Eastern diet, this is Mediterranean diet. There's a difference. So there is another diet that we use for patients that have high blood pressure and heart disease. This is called DASH. DASH stands for Dietary Approaches to Stop Hypertension. Again, it's very similar to the Mediterranean diet. The focus is on eating lots of fruits and vegetables, whole grains, low-fat dairy products, poultry and fish, nuts and legumes, and non-tropical vegetable oils. What you should limit: saturated fats, salts should be limited, red meat should be limited, sweet and sugar should be limited. So that's mainly the DASH diet. You can easily find this diet on the internet, and if you have high blood pressure or heart disease, you should try to follow this diet. Try to eat balanced meals. So try to control portions, eat smaller portions. more, as I said earlier, eat more vegetables, fruits, and whole grains. So majority of your uh, food, majority of your meal should include non-starchy vegetables, low carb foods. So because these have fibers, these have minerals and different chemicals, plant chemicals that can help lower your blood pressure. If anybody has diabetes, they should eat a low carb diet, and preferably the carbs should be combined with either fat or protein, so that the absorption is not um, rapid, and it decreases any spikes in the blood sugar. Sorry. Um, One of the most important things that as a hypertensive patient you should do, and your doctor will advise you, is to cut back on salt intake. Less than 1500 milligrams of salt in a day should be your target. So a lot of times food that we buy from the grocery store already has salt in it. So you have to make healthy choices when you're buying food. Read the label and see how much sodium is in each serving of that food. So try to buy the food that are lower in sodium content. So most foods that would be high in sodium would be processed meats, will be ready-made dinners, snacks. So those you should try to avoid, or find healthier alternatives that have low sodium or low salt. As far as the fats, try to eat less saturated fat. Saturated fat is found in animal sources, for example, in meats, found in dairy products. So try to drink maybe fat-free milk or 1% milk if you can. You can eat some unsaturated fats. For example, avocados have good fat, and olive oil, nuts, and seed, etc. They have oils and fat that is healthier compared to animal source fats. Try to avoid trans fats and interesterified fats. These are fats that are found in margarine and other commercially available products such as cookies and cakes and so on. Fish is a very healthy food. Different fish have different characteristics. Cod, tuna, and halibut, they are low in fat content, so they're good fishes. Similarly, salmon and mackerel and others, herring, they are high in omega-3. Omega-3 is good. Omega-3 fatty acids are good for your heart health, so we should try to eat and consume more of those type of meats. So that's the second thing. After you look at your diet and try to improve your diet, the next thing is to try to lose weight. If you're overweight, even losing 5 to 10 pounds can make a big difference. It can help your blood pressure. It can help your risk of your heart disease, and decrease your cholesterol. So it's important that you try to work on your weight if you're overweight. Exercise should be part of everybody's lifestyle. Cardio exercises, at least 150 minutes in a week. You don't have to do the 150 minutes all at the same time. You can break it into smaller time segments. You can do 30-minute segments, 30-minute times of exercise 5-6 times a week. Also include some resistance exercises by using weights 2 to 3 times a week. So obviously you have to make sure that you talk to your doctor before you start any type of exercise. Make sure you get a clearance from your doctor. Stress, another risk factor for high blood pressure. So we all have different stresses, stress from work, from job, from family, from other reasons. So try to minimize stress as much as possible, and that in turn helps lower the blood pressure. One thing that we can do to help our health in many ways is to quit tobacco. And that is all forms of tobacco, whether it's smoking cigarettes, cigars, pipe, hookah, or any other form of tobacco. All are harmful for the health. So this is the single best thing that one can do, is to stop smoking and stop using tobacco. Tobacco damages the blood vessels, like I mentioned earlier. When it damages the blood vessels, the body responds by making plaques, and that plaques can rupture and can cause heart attacks and strokes and so on. So tobacco affects all that. It can accelerate that process. So high blood pressure is responsible for that, but if you're smoking and you have high blood pressure, that is going to compound the problem. A lot of times patients have more than one health condition present concomitantly. So they may have high blood pressure, they may have diabetes, they may be obese, high cholesterol, kidney disease, or many other conditions. So a lot of times you have to treat those conditions as well for the blood pressure to get better. So if somebody is obese, as I mentioned earlier, they need to lose weight. The diabetics need to control their diabetes, because if they don't control their diabetes, their blood pressure is probably not going to get better. Thyroid disease needs to be addressed. You should, if you have thyroid disease, see an endocrinologist. Dr. Qureshi can help you with that. Kidney disease, it needs to be addressed. Some pulmonary and respiratory diseases will cause high blood pressure. Sleep apnea causes high blood pressure, so that needs to be addressed. If you have sleep apnea, see a sleep specialist. Use your CPAP machine at night. If you have high cholesterol, lipids, we call it hyperlipidemia, and that needs to be addressed. Some people are using steroids for medical reasons. Steroids can cause your blood pressure to go up. NSAIDs are non-steroidal anti-inflammatories. These are medications like ibuprofen, Motrin, Aleve that you buy over the counter. They can raise the blood pressure, especially if somebody already has high blood pressure. It can make the blood pressure worse. So try to avoid those medications if at all possible. So if all this does not work, the next step is going to be adding medications. Your doctor will add medications, but keep in mind that medications is just one aspect. You still have to do the lifestyle modification, and that's the key. On top of that, you add medications to have a synergistic effect. So this is a list of medications. I'm not going to go over that. There are many, many more. These are different classes of medications that doctors can use to treat high blood pressure. Quite often, patients may be on 2, 3, 4 different medications to control their blood pressure. And if a patient with high blood pressure has complications from high blood pressure, then they should see the specialist for those complications. So, and what else can you do to help yourself is to monitor your blood pressure, to check your blood pressure. Buy a simple blood pressure machine from any of the pharmacy stores. Keep it at home. Check your blood pressure as often as you can. Maybe 4 or 5 times a week. And sometimes you should check even more often. One thing that you should do is keep a diary. Take a notebook, write the date, the time, and your blood pressure, and take that diary to your doctor and show them what is your blood pressure at home. That's more important than what your blood pressure is at the doctor's office. You go to doctor's office 3 or 4 times a year, they check your blood pressure once, and that's it. But what is your blood pressure like when you're at home? That you live most of your lifetime at home. So what is your blood pressure like at home? That's more important. So if your blood pressure is not controlled at home, that's what we want to know. And when it is not controlled, when it is controlled, so we can adjust the medications, that's important. So that's why you should keep a diary and take that to your doctor. In simple terms, the goal for blood pressure is to bring it down below 140, the top number, and 80, the bottom number. So that's the number that you should target. Some patients would have a lower target. For example, patients that have diabetes, their target probably is going to be around 130, the top number, and the bottom number is 80. So that's pretty much it. And now I'll be happy to take any questions. Well, Kusam. Yes, this 120 and 80 is standard for every age group. Even for elderly, you still use the same blood pressure. Um, but you may be less aggressive treating an 85-year-old who has a blood pressure of 150 versus a 25-year-old who has a blood pressure of 150. Because if you treat an 85-year-old who has a blood pressure of 150 and try to bring it down, you may have more complications. Their blood pressure may drop and they may have complications. So the treatment goals may be different, but the definition is still the same. And it does not make any difference what ethnicity it is. The cutoff is 120 over 80 for hypertension. Again, that's relative. Low blood pressure. The question is that if blood pressure is low, like 100, the top number, or 60, the bottom number, is that low? Should people panic? Not necessarily. The That's relative. So somebody's blood pressure may be 100 over 60, and that's normal. They're able to function. They're not having any symptoms, so it's fine for them. Somebody may have a blood pressure of 120 over 80, so and their blood pressure goes down to 100, they may start becoming symptomatic. So that's when you need to worry about whether the person is having any symptoms or not. So the number itself is really not as critical as is the symptomatology. If they're having symptoms, that means that it's not it's not normal for their body. The body is not liking it. Ishad? If you control your cholesterol, you obviously will prevent the further buildup. Um, you may not be able to regress it, but taking medications can help, like statins. I'm sure you all have heard of that, those medications. So those medications sometimes can help with not only on further progression of the disease, but also it may help in regression of the plaques, especially the cholesterol part of it. But if the plaque is not just the cholesterol, it also has some scar tissue, fibrous tissue, cells, and those you cannot change much, but the cholesterol content can be changed. So low blood pressure, what kind of symptoms it can cause? So when the blood pressure is low, it's not going to provide enough blood flow to different vital organs. One of them being the brain. So person might feel dizzy or lightheaded, may feel weak. Those will be the symptoms that you can tell um, that your blood pressure is low, and is if your symptoms from that. Um, and then other than that, really, um, if you do some blood work and you might see if your blood pressure is really low, you might have some kidney issues, but that's typically when you're sicker. Patients are sicker then. So mainly for a patient that is, let's say you're at home, your blood pressure is low, and you're feeling dizzy, lightheaded, or you feel like you're going to pass out, that's symptomatic. That's what symptoms you're looking for. Weakness. Yes. The treatment for low blood pressure is going to depend on what the cause is. Um, it could be many different causes. It could be somebody is dehydrated, so then you have to hydrate yourself. If somebody has high blood pressure and they're taking blood pressure medications, they can significantly drop the blood pressure. So, and that could be a side effect of blood pressure medication. Um, it could be from hemorrhage, bleeding. Somebody is bleeding severely, their volume is going to go down, so their blood pressure will drop and they will become symptomatic. So it really depends on what the cause is. That's how you treat it. But the first thing you would do is, if somebody's feeling dizzy, lightheaded, or feel that they will pass out, sit down, lie down, raise your legs so that the blood flows towards the brain. Blood flowing to the brain is more important than flowing to the legs. So you raise your legs slightly so the blood flows by gravity towards the brain and the heart. And obviously at that stage, it means that you need to get medical attention. So if it is not very symptomatic and your blood pressure and you don't have high blood pressure, drinking a salty drink may help. Salt causes the blood pressure to go up. So we treat blood pressure by limiting salt. So if somebody's blood pressure is low, and there is no contraindication, somebody does not have a heart problem, then they can put some salt in water and maybe lemonade or something. That might help temporarily. I think all of them are important. It may depend on each individual situation. If somebody is having lots of stress, extraordinary stress, then in that case, then they have to work on their stress. On the other situation, somebody may be just eating too much salty food and fried food, or going out in the restaurants or eating snacks. So they need to cut back on that. They may not have stress as much. So it will depend on the individual case, but I don't think there is like one thing that you can do to get more benefit versus something else. No, again, that's also individual. So you may feel fresh after 6 hours of sleep, and I may need 8 hours of sleep. So that's also um, that varies by individual to individual. But in general, 6 to 8 hours of sleep is what's required. But I have friends that sleep 5 hours, but they function normal, and they've done this for all their life. So that's what their body needs. But majority will need 6 to 8 hours. There are always exceptions, but that's majority. Yes.
You talked about the temporary for the low blood pressure. What are the temporary measures we have to take for high blood pressure?
Really, no temporary measure for the high blood pressure. Um, if your blood pressure is high, it depends on how high the blood pressure is. If it is high enough that it is considered as an emergency, then you have to seek medical attention. But if it is high, like let's say the 120 is the normal, so your blood pressure is 130, 140, 150, then doing all those lifestyle changes can help. Um, Working on your salt, working on your diet, exercise, stress, those will help. But that's not like those things are not that will give you a result within an hour or two. Those are things that you will have to do for days to weeks to reap the benefits.
Adnan, on the same question follow-up, because we are at home and we are taking our blood pressure often, especially if you know you have problem, and you see fluctuation in the under 50, let's say, versus the 120. Is taking an extra dose of your medication advisable or not? Because you know your base is under 28 over like 84, but you look at it and it is 154. So taking extra dose, is it advisable or not?
is it if the blood pressure is consistently elevated, then obviously it means that your medications is not enough. You need more medication. But if it is once in a while it goes up, it might be a reason for it. Maybe you didn't eat well, maybe you have more stress, maybe you missed your medication, maybe you didn't take your blood pressure right. So occasional elevations don't change any of the medication, but if it's consistently elevated, then the medication needs to be adjusted. But again, I would not do it myself. I would get the advice from the doctor, because they could change the medication altogether. They may increase the dose, or they may change just the timings. Sometimes we have patients taking 2-3 different medicines, and their blood pressure may be high in the evening. They're taking all their medication in the morning. So we can just say, okay, take 2 of them in the morning and 1 in the evening. So there are different ways to do it. All individual patient and just case by case. So you should not, because some of those tablets and medication, if you stop, the blood pressure can rebound. It can go high, and that could be life-threatening. So it's not advisable to. You actually, if you see this last paragraph, I didn't read it, but this says that you should not change your medications by yourself. I think exactly as prescribed. Do not start medication. So that's important. I don't think one food by itself is going to bring your blood pressure down. It's the whole lifestyle. That includes healthy eating, like I said, exercise, smoking cessation, stress-related things, and so on. So it's the whole package that helps. I don't think there is a magic pill or magic food that you can take and okay, this fixes your blood pressure. I think they sell those garlic pills and this and that. Those are they don't fix the problem. It's a lifestyle modification, unfortunately, which is not very easy, but that's what it is. Any other questions? Thank you.
Jazakallah khair. Thank you. Thank you, Dr. Adnan. Thank you. Jazakumullah khair. So if all of you can move to the community room for a few minutes, inshallah, we'll have a few sweets on behalf of Brother Ayas. If Ayas can hear me too, I think he's just outside the door. So I'll drag him there. But let's just gather in the community room for a few minutes in his honor, inshallah. Jazakumullah khair.